Hello friends, I am Professor Dr. Vijay Khariwal, practicing in Delhi, Dwarka in orthopedic bone and joint disorders. I am doing general orthopedics, but at the same time my main area of concern are orthopedic rheumatological diseases, especially arthritis, osteoporosis, joint replacement, metabolic bone diseases, including osteoporosis and rickets, and bone tumors. Friends, today I am giving you broadly what is arthritis. Arthritis, we mean there is inflammation of the joint. And arthritis has many reasons because of which a patient suffers from pain in the joint, starting from a newborn to the evening of the life, where a person is going to leave this world in the next 10-20 years, where he feels severe pain in the joint. There are different types of arthritis. It can be infective, as in a newborn. We call septic arthritis, especially of the hip, where head of the femur, the joint is totally destroyed without any symptoms. Patient, because the child cannot say, and there is no pain also except mild discomfort, because the immune system of the child has not developed. So the child can present itself with fever and other things, except difficulty in moving the limb, where the acumen of the doctor is very important to treat it aggressively, but it's not that common. Another infective variety is, which is commonly seen in our country, that is due to tuberculosis. And it most commonly involves the spine. Then there are other areas where it commonly involves, that is the hip and the knee, elbow, wrist, and other joints of the body. In fact, any part of the skeletal system can be involved. Another variety of arthritis is crystal arthritis, where sodium biurate crystals are deposited in the joint. And in the common language, this is commonly known as gouty arthritis, where it can be due to genetic disorder in the metabolism of purine, or some other factors, wrong eating habits, they can lead to this. This is also common. Another variety is, which is fairly common. There are full-fledged forms which everybody can diagnose. That is rheumatoid arthritis, rheumatic group of diseases, ankylosing spondylitis, Sjogren's disease. These inflammatory disorders, they are prevalent too much in our society, but commonly, more common are subclinical form, which remains a challenge for the treating doctor to diagnose these subclinical form of rheumatic disorders. Now I come to the most common joint pain disorder that is seen usually after the age of 45 or 50, and that is osteoarthritis. Some people call it osteoarthrosis, and it is usually due to, not usually, it is due to the degenerative disorder of the cartilage covering the joint, the smooth surfaces. The cartilage gets damaged due to daily wear and tear. And in this, there are many factors which operate. The factors which operate are most commonly genetic disorder. It runs in families. There are few families where knee pain is not common, but there are few where history of knee pain can be seen. If we ask from the patient, his grandfather, father, he himself will be suffering from this, and this knee joint problem can be from mild disorder, mild discomfort, to such an extent that patient is not able even to go to toilet, to its daily activity, but to talk of going outside. And different types of different grades of pain in this. X-ray picture may be showing anything, but the pain is the main factor where the treatment of the person, the surgeon has to decide. Other factor which leads to osteoarthritis, we call secondary degenerative arthritis. It is usually because of some previously existing disease, like an old case of tuberculosis, old case of malunited fracture, where the weight bearing line gets changed, or an intra-articular fracture where there is damage to the articular cartilage of the joint at the time of injury. That leads to permanent damage to the joint, and the person develops osteoarthritis at an early age, few years after the injury, depending on the severity of the injury. Then it can be due